How are breast implants priced? I'm Dr. Victoria Aimé. I'm a board-certified plastic surgeon in Scottsdale, Arizona, and this is a common question I get. Specifically, many of my breast augmentation patients will ask me if I choose an implant with however many cc's, is that going to cost me more than an implant of less cc's? And the answer in my practice and in most practices is no. The number of cc's or the volume of the implant you choose generally should not change the price of the implant to you. But there are some factors that do affect the pricing of breast implants. Number one is the manufacturer of the implant. So when you decide to have a breast augmentation, your plastic surgeon will purchase breast implants on your behalf from a manufacturer like Allergan or Mentor or Motiva or Sientra. And then after those implants are placed, then we have to pay the manufacturer for those implants that we used in your case. And the price that is set by the manufacturer is independent of us. We have no control over that. They can pick whatever number they want. The next thing that matters in terms of pricing is whether you choose saline or silicone breast implants. Generally speaking, silicone breast implants will cost more than saline breast implants across the board, independent of the manufacturer. Now, within silicone breast implants, there are a couple of factors that will also affect the pricing. So number one, how cohesive the gel inside the implant is or how firm it is can affect the pricing. That's not totally universal across the board, but it is pretty common to be the case. The second thing that can be affected within silicone breast implants is how full the implant is. So optimally filled implants tend to wrinkle less, and typically the manufacturer will charge more for those implants. These little nuances may not be apparent to you in terms of pricing because oftentimes plastic surgeons will choose what they consider to be the best implant and offer only that to their patient. For example, in my practice, I don't offer less than optimally filled breast implants because they're more likely to wrinkle, and I think that they're an inferior device. What about projection? If you want a low profile versus moderate profile versus full profile or mini demi full, is that going to matter in terms of pricing? The answer to that is no. Generally speaking, that also should not matter. So the volume you choose or the profile you pick should not matter in terms of pricing. And if you find in your quote that you're being charged based on these factors, such as volume or projection, it might be worth considering a second opinion. Ultimately, you should choose the breast implant that best fits your chest wall in the volume that you want and the aesthetic profile that you're going for. And that should not affect the price at all. If you have any questions or comments, drop them below.